Just a quick warning, this episode talks about a sexually transmitted infection. As such, it discusses sexual activity and contact. If you do not wish to hear these topics, I understand if you want to skip this episode. But I really hope you stick around. There will be lots of good information here that will hopefully dispel lots of the myths and stigmas around sexually transmitted infections and may help protect you from becoming infected yourself. But with that, now let's get into syphilis. I gotta get the picture up. There we go. I'm a gay man who's been living with HIV for over 30 years. I never wanted to pass on HIV to anyone else, so using condoms during sex for most of my diagnosis was a no-brainer. I'm not claiming to be a good HIV positive person by doing this. I'm gonna be honest, I never liked using them. Condoms were a necessary evil. Not only were they uncomfortable and ugly, the physical barrier they offered became a psychological barrier to intimacy and connection. Condoms, as effective as they are always a reminder of the scary beast that was in the community, was right here in the bedroom. Excuse me. Serosorting, or having sex with people with the same HIV status, happened occasionally, which meant condoms went out the window or stayed in the condom pack. But generally, condom use was consistent. I'm from the generation that was taught safe for sex, condom use, equals hot sex, and barebacking or condomless sex equals taboo and death. As an HIV positive man, I was always aware of STIs, but always in the context that they might make HIV transmission to people I was having sex with easier. Apart from a case of gonorrhea in the 80s, I hadn't had a single STI in over 20 years. So, as annoying as those pesky condoms were, they prevented me passing HIV onto my partners, and they stopped me from getting any STIs. In 2009, after a breakup, I used my newfound freedom and hitting my 40s to reconnect with my sexual life and get back out there. Something had shifted in me, and the world and condoms seemed, well, past their sell date. On the hookup apps I joined, I was met with a request for bareback and raw sex. After almost 30 years of hypervigilance and near constant condom use, this brave new condomless world was both a revelation and liberating. Coupled with the emerging news that people with HIV who were on treatment couldn't pass HIV onto their sexual partners, and armed with just a bottle of lube and my phone, I embarked on my condom-free journey to discovery. But it wasn't too long before I felt a constant pain in my joints. A red rash appeared across my chest, and I started to get a high temperature. I also experienced night sweats or sweating profusely during my sleep, which was particularly frightening as night sweats were a symptom of my HIV infection I hadn't experienced since starting HIV treatment in 2001. I popped along to my GP, who couldn't work it out. I felt like shit. I was worried and perplexed and didn't have a clue what to do. About a week after that appointment, a sore appeared on my genitals. That's when I knew I needed to speak to my HIV clinician. The sexual health clinic I attended for my HIV care diagnosed syphilis right away. I received my treatment. Pretty simple, a couple of shots in the buttocks, and was sent on my way. Within a few days, the pain in my joints eased up, the night sweat stopped, and the red rash cleared up. I'd like to say lesson learned, but I've since had syphilis twice. I feel no shame in that. It comes with the territory of being an HIV positive man that has a happy and healthy sex life, although I could always do with more. However, I haven't completely thrown caution to the wind. I later found out that the symptoms I experienced were way more serious because of my HIV. And as simple as the treatment is, I don't want numb bum cheeks too often. Ooh, that was difficult to say. So I do a few things to make sure my partners and I can reduce the risk of passing on or getting syphilis. I test for syphilis every HIV checkup. This is usually every 3 to 6 months. And because I've had syphilis in the past, some syphilis tests will give a positive result, so it's more important I let the nurse and doctors know I've had the infection before. I don't want to start the whole treatment over again. I've been HIV undetectable for over 18 years, so I'm not going to pass on HIV, and I'm very open about my HIV status. This allows me to have conversations with my sexual partners about syphilis and negotiate the kind of sex we're going to have and if we're going to use condoms. Hello, everyone, and welcome. My name is Dr. Jeremy. I'm the Everyday Epidemiologist. That first-hand account was given by Mark on the website www.longtimenosif.info. There are quite a few stories of people who experienced syphilis infections on there. They are all very interesting, and I highly recommend going to check them out. Today, obviously, we're going to be discussing syphilis. But before we do that, I want to go over a few disclaimers. First, I'm not a medical doctor. Nothing in this video is medical advice. Any medical advice you want or need should be obtained from your physician. Second, this information is being brought to you by me alone as someone who knows about and works in public health. It is not coming in any sort of official capacity from the health department where I work. Third, all of this information provided in the video comes from publicly accessible websites, books, and research articles. The sources are in the description of the video. Fourth, I try to provide as accurate and scientifically based information as possible. However, I may misspeak or say something incorrect unintentionally. If you catch me in this, please leave a comment with what I said, and if possible, source to the correct information, and I'll look into it. If I was wrong, I'll provide the correct information in a future video. Lastly, there will be pictures of sick people and of genitalia in this presentation. If you're squeamish, you may wish to look away. I'll tell you when these pictures will be shown and when they have been taken down. If I miss one, or forget, I apologize. Yeah, I'm sorry about that. I will stop periodically for questions throughout the stream. However, if you have any questions, feel free to type them in the chat and I'll answer them as I see them. If you're watching later, please leave your questions in the comments and I will get to them as soon as I possibly can. So without further ado, let's start talking about syphilis. And let me pull up the next picture. Actually, I need to change my layout here a little bit. Sorry, it's been a little while since I've streamed, so I need to just get my layout, my screen's proper. All right, so now we're good. So syphilis is a sexually transmitted disease. Transmission occurs when a person comes into contact with a skin or mucosal lesion of an infected person. Exposure typically occurs through sexual contact during oral, vaginal, or anal sex. Transmission can also occur through blood transfusions if the donor is in the early stages of the disease, and through sharing needles during IV drug use. Perhaps most scarily of all, fetuses can become infected if the pregnant mother has syphilis. The disease can be passed on even if the infected person doesn't know they are infected or show symptoms. This is because the lesions, which we'll get to the symptoms shortly, may be internal and the individual may not know they are there. Typically, transmission occurs during the early stages of the disease, meaning during the first year or two after infection. Ways you cannot catch syphilis include toilet seats, doorknobs, swimming pools, hot tubs, bathtubs, sharing clothing, or sharing eating utensils. All of these have a 0 risk for catching syphilis, so you don't need to worry about that at all. It is only through those methods that I talked about. The causative agent of syphilis is the bacteria called Treponema pallidum, or T. pallidum. This bacteria, or bacteria in the Treponema genus, are in the Spirochaetota phylum and are called spirochetes. Most spirochetes, including T. pallidum, are spiral-shaped, hence the spirochete spiral. Yeah, that's where they get the name. It is closely related to the bacteria T. pertinui, something like that. These Latin words are very difficult. I apologize if I mispronounce them. I'm doing the best I can. But T. pertinui is the causative agent of the disease yaws, which we may cover in a future episode. Humans are the only source for the T. pallidum bacterium. There is no animal reservoir that we know of. Now, that does not mean that there aren't other animals that don't get syphilis. Koalas, in particular, are known for getting syphilis, but it is caused by a different bacteria. I don't know what the bacteria is. I didn't look that up. Probably should have, but it is not the same bacteria as what causes syphilis in humans. So, didn't cover very much yet, but the opening story was kind of long, and I want to stop and see if there are any questions that you may have at this point, and if there's anything in particular that you really want to know about syphilis that hopefully I'll be covering, or if not, that I can look up. So, do you have any questions about syphilis before we move into before we move forward into the symptoms and complications? What else can get a strain of it? What else can get? I assume you're asking what else can catch. What other animals can catch syphilis other than humans and koalas? Koalas. Koalas are known to get syphilis. There are probably others. In fact, I'm sure there are other animals that can get it, but yeah, actually, syphilis in koalas is a really big issue. There's actually a syphilis research center in Australia trying to investigate and treat and prevent syphilis in koalas because it's a really, really bad issue in koalas. But yeah, I don't know what else can get it other than that. I'm sure there are other animals that can. All right. Well, excuse me, I've got some phlegm in my throat today, ever since I woke up. So I'm hoping I'm not getting sick, but it's definitely possible. Well, don't see any other questions at this point, so let's move on. What does it look like when you become infected with T. pallidum and get syphilis? And if you do get syphilis, how is it treated? Well, the long story short of syphilis is it sucks. Syphilis kind of sucks. Syphilis symptoms occur in 4 stages: primary, secondary, tertiary, also called late stage, and latent stage. Though latent is sometimes split into early latent and late latent, so kind of 5 stages, but really 4 stages is what we really talk about. The incubation period, or the time between the infection and when the first symptoms show up, is between 10 and 90 days, with a median between 21 and 25 days. Throughout this section, there will be pictures of the disease, including some of infected genitalia. If you wish to look away, I understand. I will let you know when these pictures are taken down. So the pictures are coming on screen now. In primary syphilis, a papule or raised area of skin that is typically less than 1 centimeter around is the first symptom. Usually, there is only one papule, and it is possible there can be more, but that is rare. And typically happens in people who are either HIV positive or have other immunocompromised or are immunocompromised. There we go. We'll say it that way. This papule occurs at the site of inoculation, where the bacteria infected you, where it entered your body. As such, it is normally found on or around the genitalia or the mouth. In women, it may appear on the cervix or inside the vagina. This papule is a painless bump and therefore is frequently unnoticed by the patient. This quickly progresses to a painless indurated ulcer called a chancre, which you can see on the screen now. At this point, there is a raised, thickened border roughly 1 to 2 centimeters in diameter and a clean base. People with HIV often have multiple chancres. Without treatment, these chancres resolve in about 3 to 6 weeks. They can, but don't always leave scarring. About 80% of cases experience swollen lymph nodes, but obviously not everyone does. Even though the chancres are the only symptom at this point, the bacteria very quickly disseminates through the entire body, including the cerebral spinal fluid, or CSF, which is the fluid that surrounds your brain and spinal column. Up to 70% of early syphilis patients show changes in their CSF consistent with neurosyphilis, which we'll talk about more later. And 30% will have direct evidence of the bacteria in their CSF. Despite this, very few people develop clinical symptoms of neurosyphilis. But as I said, we'll talk more about neurosyphilis a little bit later, because that's one of the tertiary symptoms. 2 to 8 weeks after the disappearance of the primary symptoms, about 25% of untreated syphilis patients develop secondary syphilis symptoms. These symptoms have multiple systemic manifestations and can involve any part of the body or body system. These people can experience fevers, myalgia, or muscle pains and aches, headaches, anorexia, sore throat, weight loss, joint pain, fatigue, enlarged lymph nodes, and skin symptoms. These skin symptoms appear as a diffuse and extensive maculopapular rash, which features flat, discolored, frequently red areas and elevated lesions. This looks very similar to chickenpox, heat rash, or some allergic reactions. This rash typically includes the palms of the hands and the soles of the feet and can cause lesions in the mouth. This rash is the characteristic symptom of secondary syphilis. And even without treatment, these lesions resolve usually in a couple of weeks. But for about 25% of untreated people, they will reappear within the next 12 months. Without treatment, the disease enters the latent stage at this point, and about 33% of people, 25 to 33 depending on the source you see, but most say about 33% of people will progress from the latent stage into tertiary syphilis eventually. Now, before I talk about tertiary syphilis, there are a couple of secondary syphilis symptoms or complications I want to mention. About 50% of secondary syphilis patients will develop something called condyloma lata. These are wart-like plaques that may be painful and usually appear around the genitals, rectum, or perianal region, as you can see in the picture here. Some HIV-positive patients may develop a rare but aggressive form of secondary syphilis called luz maligna, or malignant syphilis. In this, the skin manifestations are more significant, severe, and persistent than typical. These lesions are usually found on the face, limbs, and trunk of the body. Other risk factors for Luz maligna are diabetes, history of drug use, psoriasis, alcoholism, syphilitic hepatitis, musculoskeletal disorders, transient nephropathy, and acute renal failure. Yes, you got latent syphilis before you go into tertiary syphilis. So after you get the secondary symptoms, the symptoms go away, and you enter latent syphilis. And you can stay there for months, years, decades before you go into tertiary syphilis. That's a good question. Thank you. Sorry if that wasn't overly clear. All right. So for now, at least, the pictures of the symptoms are off the screen. So, did I say what triggers the transition? Time. The disease just pops up whenever it's ready to. I didn't see in the research any specific trigger that leads from latent syphilis to tertiary syphilis. It's just during latent syphilis, the bacteria is still circulating through our body, causing damage to the body, causing the issues that will lead to the tertiary syphilis symptoms. And just at a certain point, those symptoms rear up and you can notice them. But it's not like the disease, the bacteria is not doing anything during the latent syphilis. It is. It's just it takes time for those the damages to accumulate. So that's really the main thing. Latent reminds you of chickenpox with shingles. Yeah, kind of similar in that. The causative agent, whether it's the bacteria for syphilis or the virus for chickenpox, sticks around, hangs around, and eventually does or may rear up again in the future. Again, with syphilis and with chickenpox, not everyone gets the later issues. Not everyone gets tertiary syphilis. Not everyone gets shingles. But the causative agent is still there and can come back. Kind of also similar to things like herpes. Though herpes is a little bit different because herpes, the genetic material from the herpes virus gets into the DNA in your cells. Hi, aphid. And then can rear up from there. So it's a little bit different, but kind of similar to that as well. There are a lot of diseases that actually have kind of a latent period sort of thing where the diseases can pop up later, either as the same disease or as or same symptoms or different symptoms. It's kind of interesting. Good questions. Thank you. So, what is latent syphilis? If you aren't treated, the disease progresses from secondary or primary syphilis, if you don't get the secondary symptoms, into the latent stage. This stage is sometimes called the hidden stage because you have no symptoms. Latent syphilis can last for years or decades. It is possible that you may never have symptoms again. Sometimes you'll revert back into secondary symptoms. Sometimes you'll progress into tertiary symptoms, but it may never rear its head up again. However, it is still a good idea to get treated if you test positive during the latent stage because you do not want to risk progressing to tertiary syphilis. Those symptoms are nasty. I mentioned earlier that the latent stage could be broken up into early latent and late latent, but how is that done? Why do we do that? If a person with latent syphilis acquired the disease up to 1 year ago, they have early latent syphilis. If it was over a year ago, or if the person doesn't know when they were infected, they have late latent syphilis, or syphilis of unknown duration. We do this because it can change the treatment. Early latent syphilis has a easier and simpler treatment than late latent syphilis. So that's why we try to split that up. But frequently people don't know when they became infected because they don't notice that they have primary symptoms, so we treat them as unknown duration and therefore treat them as latent syphilis. If you're in latent stage, is it contagious? Yes, especially in the early latent syphilis. During the first year or two after you're infected is when you're most contagious. Typically in late latent, you are much less contagious. It can still be spread, but it doesn't spread during that time period all that often. But it certainly can. And during tertiary syphilis, it's the same. You're still fairly. I think that's sort of a bit more contagious than like late latent, but not quite as much as like primary or secondary. You're most contagious during the first year or two after you become infected, whether you have symptoms or not. After that, it sort of decreases a bit. Hi, Mayor. Welcome in. Welcome in. Thank you. Good question. Good question. Any other questions about latent syphilis before we head into tertiary syphilis? And that'll give me a chance to drink some more of my tea. All right, well, I'm not seeing anything yet, but if there is, again, feel free to put them in the chat and I'll answer them as I see them. But now let's talk about tertiary syphilis. This is where the disease gets really nasty. This stage can begin months, years, or even decades after the initial infection. There are three main manifestations of tertiary syphilis I want to talk about: cardiovascular syphilis, neurosyphilis, and gumatose syphilis. Between 25 and 40% of untreated syphilis patients will develop tertiary disease. Typically, most people say about 33%, but it can vary depending on the exact group and the study and everything. Somewhere between 25 and 40. Cardiovascular syphilis is the most common form of tertiary syphilis, accounting for 80 to 85% of all tertiary cases. These symptoms normally don't develop until at least 10 years after you become infected, and usually between 15 and 30 years after infection. These symptoms can develop slowly, but sometimes can come on relatively quickly. The most common finding in about 50% of cases is an ascending aortic aneurysm, which is caused by inflammation in the arteries. The aorta develops a white, shiny area of the artery. Let's start that over again. I totally screwed that up. The aorta develops a white, shiny area of aorta thickening, sometimes described as appearing like tree bark. Chest x-rays sometimes show calcification of the aortic arch. Luckily, this rarely leads to a dissecting aneurysm, which is very dangerous and very lethal, but it can sometimes cause left heart failure or aortic valve insufficiency, which can be very, very serious in itself. Coronary arteries, or arteries affecting the coronary system, may also be affected, leading to ischemia or restrictions of the blood supply to the heart muscle, and may increase your risk for a heart attack. So, pretty nasty. You don't want to get that. But what's arguably even worse, even more nasty, and frequently more known, I guess, by the general public, is neurosyphilis. Neurosyphilis can be categorized as early, intermediate, or late stages. Lots of stages in this disease, huh? Makes it a little bit more complicated to understand everything. But as I mentioned earlier, about 30% of untreated syphilis patients will show CSF abnormalities consistent with neurosyphilis, but not all of these will develop neurological symptoms. Only between 5 and 10% of untreated patients will get neurosyphilis. There are 3 main presentations of early and intermediate neurosyphilis. Asymptomatic neurosyphilis is the most common form, and this is where there are CSF abnormalities, but no actual neurological symptoms. Meningeal neurosyphilis starts at least 1 year after infection, but can happen later. Typically, symptoms include a headache, nausea, vomiting, neck stiffness, photophobia or light sensitivity, cranial nerve defects, and seizures. This is because the meninges or the lining of the brain is inflamed. Meningovascular neurosyphilis presents in about 5 to 12 years after infection. This is defined as inflammation of the meninges as well as the inner lining of the arteries of the brain, which could lead to stroke. All right, I may get to this later, so you can hold. How treatable is tertiary? I will get to treatment shortly, but it depends. It depends. The syphilis itself, once you get to tertiary, is treatable. Some of the symptoms are a bit more complicated to treat, especially a lot of the neurological symptoms. Once the damage is done, and even in the cardiovascular, once the damage is done, the damage is done. And, like I do talk about it a little bit later with the cardiovascular, it may need surgery to repair and replace the aorta, the aortic aneurysm. But like the neurological stuff, I don't know. I didn't see much about treating the neurological symptoms of neurosyphilis. So I don't really know. Luckily, tertiary syphilis is not very common anymore. But we'll get to that more later as well. But good question. Good question. Early symptoms of meningovascular neurosyphilis include headache, nausea, vomiting, and vertigo. Spinal cord blood vessels may also be impacted, causing spastic weakness, sensory loss, and muscular atrophy, or decreased muscle tone. Late neurosyphilis, sometimes called parenchymal syphilis, shows up more than 10 years and sometimes multiple decades after infection. There are 2 main manifestations of this type of neurosyphilis. Syphilitic paresis, sometimes called paralysis of the insane, though I don't think that's used very often anymore. Paralytic dementia, or general paresis. This is caused by chronic meningoencephalitis, which is the simultaneous inflammation of the brain and the protective lining of the brain, leading to brain atrophy or brain shrinking. Symptoms can occur very slowly or quite suddenly. The early symptoms of this are irritability, personality changes, changes in sleep habits, and forgetfulness. Late symptoms include memory and judgment impairment, confusion, depression, agitation, psychosis, delusions, and seizures. The second form of late neurosyphilis is called tabes duralis. This results from the degeneration of the posterior column and root of the spinal cord, so the back of the brain and the spinal cord where they meet. These patients have an unsteady gait, balance issues, stabbing pain, bladder dysfunction, loss of proprioception, or the ability to know where your body is without really having to look at it, and changes in your vision. The final form, sorry, there's a picture of the symptoms up. Sorry about that, forgot that was here. The final form of tertiary syphilis is a rare one called gumatose. Yeah, there we go. Gumatose syphilis. This is where the gumas, or nodules with necrotic symptoms, form. Necrotic centers form. Man, I'm just really struggling with this. This is where gumas, or nodules with necrotic centers, form. Man, that sentence should not have been that hard to say. These typically affect the skin and are found in the livers, testes, brains, heart, and bone, as well as the skin, and they can be found anywhere, but those are the main ones. They can be really nasty and even eat through the skin, as you can see here. Really nasty looking disease. So that is tertiary syphilis. Those are the things that, if you go untreated, you may have to look forward to in your future. That is why you get treated for syphilis. So the pictures of the symptoms are now down, and I don't believe there are any more graphic images for the rest of the stream. So before we get to treatment, there is one other form of syphilis I want to discuss called congenital syphilis. As I mentioned earlier, syphilis can be passed through the placenta of an infected mother to the fetus or to the baby at birth if they come into contact with infected lesions. Hey Matt, thanks for being here. Thanks for lurking. Most neonates or newborn babies born with congenital syphilis are asymptomatic at birth. They don't have any symptoms. They don't have any issues. However, if syphilis is present, missed the line. One early sign is during pregnancy. Normally, during pregnancy, the weight of the placenta will increase. That's typical. However, if syphilis is present, this occurs at a greater extent. More than 75% of infants born with a placenta larger than the 90th percentile were found to have congenital syphilis. Does syphilis cause infertility? That was a key part of a mystery I read once. I did not see any indication that that is the case. People with syphilis, both males and females, can have kids. So I don't believe it does. It's I guess it's possible that it could, but I did not see anywhere that was listed as a side effect of syphilis. So, to my knowledge, no, it does not. And I do know, as I said, people with syphilis can have kids, both males and females. It could have been a different STI. There are some STIs that can cause infertility. Or it could also just be that the mystery is wrong. That's possible as well. Yeah, absolutely. But no, I don't believe syphilis does. Congenital syphilis can cause spontaneous abortion, stillbirth, premature death, low birth weight, or death shortly after birth. However, if the baby survives all of that, what are the symptoms that they may experience after birth? These symptoms typically develop within the first 3 months and include a generalized rash, anemia or low blood count, jaundice, where the skin or eyes turn yellow, hepatosplenomegaly, or an enlarged liver and spleen. And other symptoms can include nasal cartilage destruction, bowing of the leg bones, particularly the tibia, peg-shaped upper incisors, brain and nerve problems, blindness or deafness, meningitis, skin rashes, and more. Not all babies, as I mentioned, have symptoms at birth or even in the first 3 months. These symptoms can show up years later. Babies that are not treated for CS, congenital syphilis, who develop symptoms later may still die from the infection. Even if they don't, they may be developmentally delayed or have seizures. Congenital syphilis is a horrible disease, but as I'll explain later, it is 100% preventable, or nearly 100% preventable at least. If a baby is born with it, how treatable is it? There's another comment up there. Because the bacteria can pass from mother to child, in your country, you test all pregnant women for syphilis. Good. Absolutely. That's the way it should be. Yes. Every pregnant woman should get tested at least once during pregnancy, during their first antenatal visit, during their first pregnancy visit. And if you're at high risk for syphilis, meaning you have lots of sexual partners, have experienced drug abuse, homelessness, or one of various other risk factors, getting tested a second time later in your pregnancy during the third trimester is also important. And for high-risk individuals, getting tested at birth, at the child's birth, is important as well. But yes, every woman should get tested at least once during pregnancy. And Mayor also says, if a baby who is born with it, how treatable is it? Very, very. We'll actually get to that in just a couple of sentences, but it is very treatable, luckily. And luckily in general, this entire disease is very treatable. Patients with primary, secondary, or early latent syphilis, meaning those who are within the first year of being infected, just need a single dose of penicillin, a single shot of penicillin. That's it. Just one shot. And for those who are allergic to penicillin or for some other reason can't have it or can't get it, because at least in the US right now, there is a penicillin shortage, which is very problematic. This is not a short-term shortage either. We've had this shortage for a year and a half, 2 years now, and it's going to continue at least for another 6 months. Yeah, it's problematic. But in those situations, you can take doxycycline or some other form of antibiotic for a more extended period, typically up to like 14 to 28 days, and that can treat it as well. If you have late latent, or the duration is unknown, or if you have tertiary syphilis, you need 3 shots of penicillin, 1 shot per week for 3 weeks. And as I said, those who are allergic to penicillin can take doxycycline or some other antibiotic. People with cardiovascular syphilis may also require cardiothoracic surgery with aortic valve replacement or to repair aortic aneurysms. Going back to Susan's question about tertiary syphilis treatment. Again, as I said, I didn't see really any treatment options for neurosyphilis, so I don't know what those might entail. For the neurological symptoms at least. But the neurological or neurosyphilis treatment for the syphilis itself, for the bacteria itself, needs not the regular shot of penicillin, but they need aqueous crystalline penicillin for 10 to 14 days. So it's a little bit different treatment for the syphilis for that, but I don't know if there's treatment for the neurological damage that it caused. But yeah, that's a good question. Yeah, overall, very easily treatable disease. I do want to mention that if you do get syphilis and you do need the 3 shots or the longer term dose of antibiotics, get the full treatment. If you don't get the full treatment, if you don't get all 3 shots, if you don't take all 28 days of doxycycline, you are not treated. The full treatment is necessary. And if you don't take the full treatment and you want to finish it up later, you can't just finish it up later. So if you get 2 shots in the first 2 weeks and then you miss the third one and you realize, a month later, oh, I need to get the third shot of penicillin. No, you got to start at the beginning. You got to get all 3 in 3 weeks. You can't just go back and get that last one. Not going to cut it. So if you get syphilis, get the full treatment. Take the full treatment. All right, so I know there have been a lot of information here, a lot to digest, and there have been some great questions already in the chat. So let's go ahead and stop here and see if there are any other questions. And then I'll talk about prevention, state of the syphilis in the world today, and what public health does about syphilis. All right. Susan asks, how hard is tertiary syphilis to diagnose when a person is having cardio or neurological symptoms? Same question for babies. I don't know. I really don't know. It probably a lot depends on if a patient comes in with the neurological or cardiovascular symptoms. I don't know how distinguishable necessarily they are from other non-syphilis related neurological or cardiovascular symptoms. There might be a lot of overlap, there might not, but obviously if they have these symptoms and they test positive for syphilis, you can assume it's syphilitic, tertiary syphilis, syphilitic symptoms. For the cardiovascular system, as I said, it has the aorta has that tree bark appearance, which is pretty unique to cardiovascular syphilis. But especially with the neurological symptoms, I don't really know. I don't really know a whole lot about other neurological diseases. So I don't know really how that works. Same question for babies. So congenital syphilis is fairly easy to diagnose. Especially with like the bowing of the tibia, bowing of the leg bones. And most kids that get diagnosed with congenital syphilis are because the woman tested positive for syphilis at birth. But as I said, a lot of the kids born don't have any symptoms, which is a very good thing. But if the mother tests positive, the baby is sometimes tested, not always. But if the mother tests positive for syphilis at birth, the baby's always treated. And it's assumed that they have congenital syphilis and they are treated. They're given the 10 days of antibiotics. But yeah, I don't know if there are a lot of tests, congenital syphilis tests done if the mother doesn't test positive or if they don't test the mother at birth. But if there are the symptoms, then they will test both the mother and the baby. But yeah, it could be easy to miss a lot of those symptoms. But yeah, the congenital syphilis, as I said, is mostly diagnosed through the mother testing positive. What is the frequency of people not getting the full treatment as directed? I don't know. Yeah, I don't know. We can check that out. Complete Let's see. So let's pull this up. All right. What percent? What percent of uh, people don't complete syphilis treatment? Let's check out this article. This talks about risk factors. Oh gosh, I hate these things. Bicycles. That's not a bicycle, so we'll see if that works. No, no. God, I hate these things. These things are horrible. Why? Oh my gosh. More. Hopefully that will do it. Oh, I must be a bot. This is ridiculous. Oh, what the heck? What the heck? Come on. Oh my gosh. Maybe. There we go. Finally. Okay. Here's some risk factors. So this one may talk about it. Um, well, here in this study, 52% completed treatment. That's not very much. 52% is horrible. Yeah, Mayor also hates bicycles and stairs. Yeah. But that is only a study of 171 patients. So I don't know how generalizable that is to the general population. Let's see. No, that's not what I'm looking for. I don't know. I don't know. It's probably a very hard thing to really determine, because getting data is difficult. But yeah, I don't know. I don't know. This just talks about that it is treatable. Let's see, cure rates. So yeah, as I said, very curable during primary early and or secondary early latent. If you complete the treatment, 95 to 100% treatable. Late latent, only a single dose will only cure about 50 to 60%, which is why I need the full 3 doses. But let's see. Let's see. So here's some more information about the treatment options. But yeah, I don't know. I don't know. Can't see. Can't find information quickly about um, treatment completion. I will write this down and I will do some more research and see what I can find, and I'll put it in a comment on this video, and I will talk about it, what I can find at the beginning of the next episode, or whichever episode I can find happens when I find the information. And percent. Okay. And I will also research, as you request, Susan, the information about difficulty in diagnosing cardiovascular neurosymptoms, syphilis. I'll research that one as well, and I will do the same thing. I'll put it in a pinned comment under this video, and I will discuss it at the beginning of whatever episode I can when I find this information. Those are very good questions. Thank you. I appreciate you you asking those. Are there any other questions about syphilis symptoms, treatment, anything at this point before we move on? I guess it would be pretty hard to diagnose, since you remember they said syphilis is called the great imitator. Yeah, that would be my guess as well. There are a lot of things that cause neurological symptoms. There are a lot of things that cause cardiovascular symptoms. So without the test without the syphilis test, it might be very difficult to know, but I don't really know for sure. So I will look that up. But I do know that if they have these symptoms and they test positive for syphilis, it can be pretty sure that it's neurosyphilis or cardiovascular syphilis. All right. Well, let's go ahead and move on to prevention. How do you prevent catching syphilis? Well, the only way to completely avoid syphilis is to not have sex, not have vaginal, anal, or oral sex. That's the only way you can really pretty much completely prevent it. But there are ways you can limit your risk. One is being in a long-term relationship where both of you or everyone involved in the relationship, if there are more than two people, only have sex with each other. That can help avoid it. If none of the people in the relationship have syphilis and none of the people in the relationship have sex with other people, it's very hard to get syphilis from someone who doesn't have syphilis. Very, very hard. Impossible even. But that's only if everyone in that relationship only has sex with people in those relationships. Getting tested. If you have sex with other people outside of a relationship or with multiple partners, getting tested is a good way to know if you're infected and to help prevent spreading it to other people. If you get infected, you can get treated and stop it from being spread. So knowing the infection status of your partner can help. So hopefully, if you're having sex with multiple partners, you're getting tested regularly, and hopefully they're getting tested regularly and getting treated if you are positive. That can limit your exposure, but again, can't completely eliminate it because not everyone is going to get tested. Not everyone's going to know that they're infected. So, another way to help limit your exposure is wear condoms. Have safe sex. That can decrease your risk. If you're having oral sex, using a dental dam or a mouth condom can help as well. However, this isn't perfect either, because the syphilitic lesion may be in an area not covered by the condom. And if that's the case, you can still get infected. So if you're sexually active and not just with your partner, use a condom and get tested. Those are the easiest ways to limit your exposure, to limit your risk for getting syphilis. Be safe. Be safe. I'm not saying don't have sex. Definitely have sex. Sex is awesome. Sex is good. Just do it safely. Do it safely. The other way to help prevent the spread, as I mentioned, is get treated if you do become infected. Mayor, may I add, testing for syphilis is pretty simple. They take a blood sample and test if there are any antibodies in your blood. Exactly. The treatment for syphilis is very simple. It's just a quick blood draw. And at least in the US, I don't know how widespread it is outside the US. but in the US at least, there are at-home testing kits where you can test yourself. You don't even need to go to the doctor to get tested. And these at-home testing kits are incredibly simple as well. I don't know exactly how they work. Actually, let's look that up. Let's look that up. Let's see. How do at-home syphilis testing kits work? We'll just go with this one. Not sponsored, not necessarily recommending this particular brand, but yeah, it's just the first one. So, let's see. Okay, yeah, it looks like just a quick needle draw, probably from the fingertip, kind of like if you're testing blood glucose for if you have diabetes. That would be my guess. Is just prick your needle and put it on the pad, put it on the testing kit, and it will test for the antibodies to see if you're infected or not. So yeah, very, very simple, very, very easy. And at least this brand, pretty cheap. Just $25 or more cheaper if you buy it in bulk. So yeah, don't even need to go to the doctor to get tested. Easy to do at home. So get tested. Get tested. Testing is good. All right. Congenital syphilis can be completely, or at least nearly completely, prevented by getting tested for syphilis during pregnancy, and if you are positive, getting treated. Every pregnant individual should receive syphilis testing at least once during pregnancy, typically at your first antenatal or pregnancy exam. People at high risk should be tested multiple times, as this figure indicates here. Get tested at your first prenatal visit, get tested again later in delivery, and oftentimes, especially if there's no positive test or if the person is at high risk, they'll be tested again at delivery. And should you test positive, get treated. Get treated, please. But if you are pregnant or working on getting pregnant, consult with your physician during your antenatal prenatal checkup to see what is appropriate for your particular situation. So, with all that out of the way, what are the current trends in syphilis? This is also where syphilis really sucks. The trends are not looking good. In the US, globally, and in most individual regions of the world, syphilis cases are increasing. And this increase is not just due to the fact that there are more people. The rate of syphilis cases, meaning the number of cases per 100,000 people, is increasing as well, which is not good. Not good at all. Globally, in 2015, there were about 6 million new cases, with about 150 new cases per 100,000 people. By 2025, this graph doesn't go up to 2025, but by 2025, that number had increased to 9 million new cases and 187 new cases per 100,000 people. So both the number and the rate of syphilis are increasing. In Europe, in 2022, there were 8.5 new syphilis cases per 100,000 people, which is a 35% increase from 2021 and a 41% increase from 2018. In Asia and the Pacific, the rate rose from 20.1 per 100,000 in 2010 to 34.5 per 100,000 in 2020. Africa, particularly sub-Saharan Africa, is has a disproportionately high burden of syphilis, but the exact numbers are very hard to find due to gaps in surveillance. In the US, in 2024, there were over 2.2 million new syphilis cases reported. This was a 13% increase since 2015. However, luckily, there was a 9% decrease in 2023, or from 2023 to 2024. This was the third consecutive year of a decrease in new syphilis cases in the US. So that trend is good, and hopefully it will continue, but it's still much higher than it was in 2015. And even worse is about the turn of the century, around 2000 to early 2000s, in the US, we had basically no syphilis cases. We had almost eliminated it from the US. And it's back to 2.2 million cases per year. Not good. Not good. Primary and secondary syphilis cases between 2023 and 2024 decreased by almost 22%, which is down for a second consecutive year. These declines are due in part to public health efforts, including a greater awareness of the STI epidemic, and increased use of prevention tools and those at-home testing kits that I was talking about. They help. Prevention tools help. Imagine that. Now, congenital syphilis. Congenital syphilis trends are really not good. Really not good. Globally, these cases are in general on an upward trend, as are the number of adverse birth outcomes, which include fetal deaths and stillbirths, neonatal deaths, preterm and low birth weights, and infants with a clinical diagnosis of congenital syphilis. And I didn't write it down. And I think it was 2021. 2021 or 20, I think it was 2022 actually. There were 700,000 congenital syphilis cases globally. 390,000 with these clinical symptoms. That is a lot of babies born with syphilis, especially when this disease can be prevented. The US isn't any better. In the US in 2024, there were nearly 4,000 cases of congenital syphilis. That was a 2% increase from 2023. However, that 2% increase is notably lower than the double-digit increase in many recent years. Since 2015, when there were just 495 cases of syphilis reported in the US, this represents a 700% increase in cases. So, while these trends in syphilis aren't looking good, there are some positives, like the decrease in syphilis in the US that I mentioned, and the much smaller increase in congenital syphilis in the US. And in some areas of the world, particularly in Europe, the trends of congenital syphilis are looking good. They are decreasing. I actually saw an article, I don't remember when it came out, but I saw an article recently that talked about Denmark had eliminated congenital syphilis. They had had no cases of congenital syphilis for an extended period of time. So it can be done. It can be done. But why are these diseases, why is congenital syphilis increasing? Especially congenital syphilis, why is it increasing? It is due to the fact that more women are becoming infected. During the early 2000s, most syphilis cases were in men who have sex with men. But that is changing. More women are becoming infected with syphilis. And if more women are infected, there's more chance that they could pass it on to their child. The other big issue is, or one of the other big issues, is the decrease in funding for public health, and particular sexually transmitted infection public health. With this decrease in funding, we are unable to do as many outreach programs, education programs, and prevention programs. We need our funding in order to do our work. The last main issue I want to mention is the degradation of the availability of good health care and the degradation of social economic inequity. Many of the people who are infected with syphilis, especially many of the congenital syphilis cases, do not have access to good, affordable health care. Many of these people are poorer than are on the poorer end of the spectrum. Many of them are homeless. These people have less ability to get prenatal care. They have less ability to buy these at-home tests. They have less ability to go to the doctor and get tested for syphilis or get treated for syphilis. So because of all these reasons, that is why congenital syphilis cases are increasing. That is why we need to support healthcare for all. That is why we need to support public health. Because without that, these kids, these infants, these babies are becoming infected with syphilis. And that could and should not happen. So support healthcare. Support healthcare for all. Support public health. It is important. It is very important. So now that I'm done with my rant, what does public health do to prevent the spread of syphilis? And how do we respond when a case of syphilis is reported to us? The main objective of public health when it comes to syphilis is to help prevent people from becoming infected and to help those who are tested and positive to get treated. We provide information about this disease, how it's transmitted, and prevention strategies to the community. We partner with healthcare facilities to ensure that correct testing procedures are done for those that need it, particularly those who are pregnant, and we investigate every case and positive test that is reported to us. This is where I want to specifically call out disease intervention specialists, or DISs, and sometimes that are called communicable disease investigators, or CDIs. These are amazing people that investigate all of these cases. Depending on the area where they work and how big of an area it is, there can be hundreds, thousands, or even tens of thousands of syphilis cases to investigate every year. These are amazing people. Love your CDIs, love your DISs, respect them, give them props. They're awesome. But how do these investigations work? First of all, I'm sorry to any CDIs or DISs that are watching. I know what I'll be saying is very simplified. If you want to clarify in more detail, please put that information in the chat, or if you're watching later, add in more details in the comments so that other people can fully understand the amazing work that you do and how amazing you all are. These investigations typically start when a health department is sent a positive syphilis test from a healthcare provider or a testing company. The DIS or CDIs then contact the doctor to obtain additional information such as symptoms, which can help with determining what stage of syphilis the person has and what information and what treatment has already been provided. In this call, they also discuss treatment recommendations and provide information about testing protocols, reporting procedures for future cases, and any other additional case or information that the physician or healthcare facility may need. The investigator also contacts the patient. This can sometimes be very difficult, but they work very hard to try to speak with as many cases as possible. This can include multiple phone calls, sending letters, and sometimes even going into the field to do home visits. And if the person is homeless, tracking down where they might be and going out to the homeless camp or wherever they may be staying and contacting them in person. If the investigator is able to contact the patient, they try to obtain information about their sexual partners to see if those people need to be tested or treated. And if the patient has not yet been treated, they work to help this patient get treated. During these investigations, they also try to determine if the patient is pregnant. If they are, they really step up their investigations to get efforts to get the person treated. This is done to help prevent the cases of congenital syphilis. What happens if the health department finds out about a syphilis positive test at the time that the person was delivering the child? Well, that means there is a congenital syphilis case. And these cases are worked very hard. They work very hard to ensure that this case is dealt with correctly. By that, I mean they spend hours, sometimes days, trying to contact the patient and the doctors. They gather additional information about the baby to see if it showed symptoms of syphilis, and they work to ensure that the baby has been treated, or if it has not, make sure it does get the treatment that it needs. So I hope I have shown how hard these people work and how amazing they are. So with that is syphilis. So now I'll take a break to see if there are any additional questions about syphilis that you may have. So yeah, let me know. Let me know if you have any questions. So yeah, as I mentioned early on, syphilis is a horrible disease, but honestly, it's kind of a really interesting disease, especially with the tertiary syphilis symptoms and the latent period. It's really an interesting disease, but pretty nasty, It's definitely something that you want to try to avoid if possible. But are there any questions? Mayor says it's a horrible disease, but so preventable. Absolutely. So preventable and luckily so treatable. Yeah, absolutely. Well, I'm not seeing any more questions at this point. So I want to thank you all for being here. Let me change the picture. I hope you learned a lot about syphilis and are better prepared to protect yourself against this nasty disease. Limit your risk. Get tested if you are at risk, and get treated ASAP if you are infected, especially if you are pregnant. During the next stream, I think I'll probably be discussing cholera. I haven't decided for sure, but I think it might be cholera. Cholera is a super interesting disease with a fascinating history. So be sure to subscribe to my YouTube channel here so you don't miss any of my future videos. Also follow me on Bluesky, where I share a lot of disease and public health information and news between episodes. You can find the link to that in the description to this video. Stay healthy, stay happy, and remember, public health is for the good of everybody. I'll see you next time. Bye.